Hi friends, Dr. Swami Ventrapalli from Attune Health. Thank you for tuning in to this new update on COVID and related infections that have been ravaging our community for the last several weeks. I hope you find this update useful, and as usual, appreciate your comments after the post. So what's a tripledemc? Well, we're in one. We have three viruses that are ongoing right now and causing a lot of symptoms. Of course, we have COVID. We also have RSV, and we have the flu. So what we're seeing in the data is that a lot of people, especially over December and January during the holidays and travel season, have been coming down with respiratory infections. You may have been one of those people who had a respiratory infection, tested negative for COVID. Well, you weren't going crazy. It was the flu. This year's flu seems to be quite severe. And if you look at this graph, a lot of people are actually testing positive for either flu, RSV, or COVID. Between the three of them, actually, this last December, the flu was the highest number of cases that we were seeing. And COVID-19, though, was also pretty high. About 12% of tests that were done for COVID-19 were positive. This is about 17% higher than it was the same time last year, where only 10% of tests were positive. It may be that fewer people are testing. It may be that only the sicker people are testing, so that might explain that gap, but I just wanted to bring it to your attention. The main point I want to make, though, is that if you're feeling sick from a respiratory infection, it may not be COVID, it could be the flu, and it's important to know. The reason it's important to know is because we have actually got good treatments for both the flu as well as COVID-19. As of now, we don't have a treatment for RSV, but we have a really good vaccine too for it, especially in people who are immunocompromised. So the new COVID variant is known as JN1, and this variant has shown a lot of immune escape. That means that spike protein, which we're all now very familiar with, has developed some mutations which allows it to bypass the normal immune mechanisms by which one could inactivate a virus. And what does this really mean in practical terms? It doesn't mean that the virus is necessarily more severe or different. It's just able to escape the immune system and cause an infection. And again, we don't know exactly what this implies. There's talk out there, if you read the internet, that this rapidly mutating virus is a big concern. But in my opinion, I think that most viruses do mutate. One of the worst viruses that mutates actually is the flu virus, which mutates a lot every year. Compared to that, COVID-19 mutations, in my opinion, as a non-microbiologist, is that the SARS-CoV-2 virus is actually mutating as would be expected for any coronavirus. So what's going on in COVID-19? Well, as I said, it's about 12% or so of tests are positive for COVID-19, and then wastewater sewage testing also shows that COVID-19 has been increasing, which we're all seeing in our clinics, and all of you might be experiencing by knowing people in your circle who have tested positive. What we're seeing is that in terms of hospitalization rates, actually, even though the COVID cases have surged, we're not seeing a lot of hospitalizations. In fact, at the same time last year, there was 21% higher rates of ER visits due to COVID-19 than in December of 2023. So I think all of that's positive news. It does indicate that the collective immunity that we have, either from natural infections or from the vaccines and prior infections, or the combination of vaccine and infection, has really dented the ability of COVID-19 infections to cause hospitalization in our patients, which is exactly what we wanted and what we wanted to hear. The statement I'd like to make is that there are still hospitalizations that we're seeing. We are still seeing a fair amount of deaths. For example, in LA County, we're seeing about 3 to 5 deaths on a weekly basis from COVID, which 3 to 4 years into the pandemic is not great news, but it's nowhere near the peaks that we were seeing in December 2021 and 2020, etc. So overall, I think we're definitely moving in the right direction. We're still seeing a lot of infections. The good news is that we have vaccines, and the good news is that we have medications like Paxlovid that still work for COVID-19 infections. In terms of the booster, this is a little bit more controversial. Should one get the new boosters? So in 2023, the FDA approved a couple of additional boosters that were formulated with the XBB 1.5, and they were thus a bivalent booster. And this is the prevalent vaccination that's available now if you were to get a COVID vaccine. And the good news is that the current JN1 variant actually is susceptible to this current booster that's in circulation at this point in time and available at your pharmacy. So that is the good news. So there's also Novavax, which actually we have not covered in any of our previous newsletters. So sorry for that. We didn't have a chance to talk about it before we took a hiatus. But the Novavax is an interesting vaccine. It's actually older technology, and it's protein technology, where the company actually produces spike proteins in an animal reservoir and then purifies them, and you inject those spike proteins into the body. Contrast this with the mRNA vaccinations, where mRNA code is injected into your body, and then your own immune cells take up that code and create their own spike proteins. So it's a different technology, it's an older technology, it's something that we're all used to taking. For example, the flu vaccine is a similar type of technology where the protein coat of the flu vaccine is injected into a person, and that produces immunity. There have been no head-to-head studies against Novavax versus Moderna or Pfizer, so I can't give you data about which is more effective or not, which one you should take. But certainly if you've had problems with an mRNA vaccination and you're looking for an alternative and you're at high risk and need a vaccine, Novavax is an option. We called a couple of our local CVS pharmacies and found out that they do have it in stock in LA, so that's good news. And so anybody who's looking for a updated vaccine, that may be an option for you. So we're going to answer some questions that have been coming through the clinic from our patients, and I'll take a stab at them. One question that I keep getting a lot of is that, hey doc, I've already had 3 vaccines, 2 original and then a booster. Should I really get another vaccine? Should I get a booster or not? So there's several studies that try to answer this question. I've reviewed about 4 of these studies, and unfortunately none of them are really very compelling. And frankly, the data can be interpreted depending on which side of the aisle you fall on. So, for example, there was a recent study that the FDA commissioner tweeted and said that having the updated booster prevents hospitalization. However, when I reviewed the study, I found that the numbers of patients were really not that compelling to make that argument, and I thought that that was an overreach. Additionally, there's a new paper from Austria, hot off the presses, and this showed that if you have had a previous infection and got another booster, there really was no difference in mortality whether you had the booster or not. So I think that this topic is highly politicized. My personal opinion is that if you're in a high-risk category, you should probably get a vaccine, but for most other people, the benefits are probably marginal at best, and the benefits of preventing an infection are short-lived, about 12 weeks or so, after which it doesn't protect you from getting an infection anyway. And it doesn't look like these vaccines in the majority of young healthy people are preventing severe hospitalization or other problems. If you are older than 65, if you are immunocompromised, if you are in any other high-risk group, which we've covered a lot, then you should consider getting the updated vaccine. Even though prevention of COVID lasts only a short while from these updated vaccines, they do give the T cells a boost as well. we've covered the T cells in some detail in some of our previous episodes. Now, the T cells in most people can live for a long time, many years, in younger people particularly. But as you get older, your T cells probably last maybe 1 to 2 years, or if you are immunocompromised, it may last even shorter. So in those people, for sure, I think a booster, there's definitely a good case to be made that you should take a booster, probably once a year, unless something on the ground changes, but that's what I'm recommending to all of my patients who need vaccines. And you should probably take an updated COVID vaccine. If you haven't had the flu vaccine, you should definitely do so. And the new RSV vaccine, which we covered in previous episodes, that may be reasonable to take as well, because it would protect an immunocompromised person or an elderly person from a very severe respiratory illness. In terms of timing of these vaccines, we recommend separating them. While there is a COVID vaccine and a flu vaccine combination, I don't recommend it because both of these are strong pharmacological products. I don't tell patients to take 2 medicines at the same time. Usually I start with 1. Same thing with the vaccines. Separate them by a week or 2. And similarly with the flu shot, I would separate it. Can you get your flu shot in January? That's the other question people are asking, and I say yes, definitely. As you saw from those graphs that I put in a little bit earlier, flu is actually more rampant than COVID in last month. So I would definitely think about getting a flu shot. It's not too late. Flu typically lasts until about March, April, May, depending on how cold it is. So I'll definitely do that. How can you tell if you have the flu, COVID-19, seasonal allergies, or a different virus? Well, you can test for it. We have tests for RSV, we have tests for flu, and we have tests for COVID-19. These are all nasal swabs. Most of the urgent cares will have these tests. Usually with a viral infection, you will have other symptoms. For example, you'll have fever, you might have body aches, you might have chills, as opposed to just having seasonal allergies where you'll have a stuffy nose, but none of those other symptoms. So that's one way to differentiate it very quickly. What about medicines? We've covered this. We recommend that you withhold medicines like Motrin, Advil, Tylenol, etc. for about 24 hours after a vaccine. That allows the vaccine to really generate a lot of immunity. And then if you're a rheumatological patient and you're on some of these drugs that we've covered, for example, methotrexate, you need to hold for 2 weeks after a COVID vaccine, and those same rules apply for the flu vaccine and the RSV vaccine. Similarly, JAK inhibitor or Rituxan, those are also very special cases where you need to consult with your doctor in terms of timing of the vaccine. And one point I want to bring up is medications for the flu, which we haven't covered a lot. We've had Tamiflu for a very long time. This is a medication that has been very effective in preventing severe flu cases, especially if you started within the first 48 hours. Now there's a new medicine, it's called Xofluza, and this is a single dose medicine, highly powerful for the flu. So if you test positive for the flu and if you're within 48 hours, that's a great time to take this medication. Just 1 dose does the job. It's highly effective against flu and it knocks it out. It does have some side effects, not severe, but a lot of interactions, so your healthcare provider has to do an interaction check and make sure that everything's okay. And that's it for me today. Thank you for your attention as always, and I appreciate the opportunity to speak with all of you.